Good morning. Welcome to this live talk. I'm Dr. Manish Shetty, consultant physician at SL Raheja Hospital. We are continuing our monsoon talks. Last year we had a very good session, and in continuation, this time I'm come with a topic that is monsoon, but monsoon and mosquitoes. A very unique heading that we have chosen for the talk today. Because a monsoon, when it comes, it is getting us a lot of respite from the scorching heat that we have been through for the last 3 to 4 months. Monsoon brings us happiness, monsoon brings the traffic, monsoon brings a lot of things. So, as a doctor, what all does monsoon bring to us? Well, monsoon brings a lot of illnesses, fevers, and all. So, today I'm going to make it a little bit simple in our language to find out, to explain things that happen in the monsoon. Mostly, there is an increased incidence of all kind of diseases, whether it is waterborne diseases, foodborne diseases. We have infections due to insect bites, and on this we will be discussing. Waterborne diseases, you see a lot of jaundice, typhoid, and hepatitis, that is the infection of the liver which comes up. We see a lot of patients who come with loose motions, that is called as gastroenteritis, mostly because of contaminated water. The main burden of diseases during the monsoon is a heading called as mosquito borne diseases or diseases which are transmitted by mosquitoes. This is a very unique way in which we say that humans are attacked by mosquitoes because mosquitoes, as such, don't cause any illness. Mosquitoes inject some kind of the carrier which comes into the blood and causes the illness. So this injection, what the mosquito carries and gives it to the patients, can be anything. It can be a virus, it can be a parasite. So it can produce a illness in our patients. What we need to know is it was very difficult for initially, say, 300 years back. Malaria was quite rampant. That is one of the diseases which we are going to talk in detail today. In 1897, it was a scientist called as Ronald Ross who found out that this malaria is transmitted by the bite of a mosquito. Hence, there was more research and we could look into the transmission, we could cut down the transmission rates and all that. That is how science has progressed and we are here today. In my talk, I will be talking mainly about 4 or 5 main mosquito related diseases. These mosquito related diseases, the incidence increases in monsoon. There are a few reasons for that. Because during monsoon, there is a lot of stagnation of water. Water gets collected in, say, running water. We have collected water, contaminated water, and all. These are all breeding grounds for the mosquito. So the mosquito lays its egg, the larvae come up, and the new mosquitoes which come out, they when they bite a person who's infected, they imbibe the bacteria or the virus inside them, and this virus is then transmitted to the next person which the mosquito bites. So it is very important for us to know different kind of diseases. So I have 4 or 5 diseases in my hand, which I will talk about in detail. We have malaria, we have dengue, we have chikungunya. These are the three major headaches that we have during the season. Also, we talk about a few words on lymphatic filariasis. There is a disease called as Japanese encephalitis. And also, what we have heard recently is the Zika virus. Coming on to malaria. Malaria by the name, everybody has heard about it. So we need to know what is the transmission. The malaria is caused by, it is the organism is called plasmodium. So we have 4 types: plasmodium vivax, plasmodium the falciparum and all. In our country, we have more predominance of vivax and falciparum. Falciparum first was the disease which used to affect the brain, which used to cause what we call as brain fevers or cerebral malaria. But now we have more predominance of Vivax, and this Vivax has also caused a lot of things. So, what can be the presentations? Our patient can come with fever, with chills, body ache, and Then our patient develops complications like involvement of the liver, involvement of the kidneys, and all that. It is very imperative for us to diagnose malaria. We do a lot of testing for this. I will talk in detail about the testing when we have gone through all these diseases. So, malaria is one monsoon related disease which is quite common. Second one, which we need to understand, is dengue. Dengue, it is a virus that is called as, it has got four types: dengue 1, 2, 3, and 4 serovirus. It is transmitted by the bite of a mosquito. This mosquito is called as the Aedes mosquito. This mosquito breeds in fresh water. So whatever collected water what you have in your flower pots or construction sites, fresh flowing water is where this mosquito breeds. Dengue disease, which comes in well with the bite of the mosquito, the patient gets infected, and you should understand that how this disease will progress. Classically, the dengue is a 10 to 14-day disease where the first 5 days you will have fever, headache, body ache, vomiting sensation on that. So, irrespective of what you do, the first 5 days the fever will persist. You will give, say, anti fever medications and all, paracetamol where the fever comes down, but usually it persists for 4 to 5 days. This is how the virus behaves. So this phase of dengue is called as a febrile phase or the fever phase. Once the fourth or the fifth day passes off, the fever usually goes away. So our patients may think that okay, now the fever has gone, dengue has been positive, but okay, maybe now we can relax. But then starts the second phase of the disease. That is the phase of dehydration. In our medical terminology, we also refer this phase as a critical illness phase. In this, what happens is the blood vessels, because of the toxins which are released by the dengue virus and the body which tries to fight it, the blood vessels become porous or they start becoming leaky. So, what happens is there is a leakage of fluid from the blood vessels into the body spaces, meaning in the sense that your lung coverings will fill up with water, your stomach will fill up with water, your gallbladder will start swelling up. So, in this phase of dengue, from day 4 onwards, the patient loses his appetite, the patient feels full, he gets dehydrated. So this dehydration, because of that leakage of fluid from the blood vessel, there are two changes which occur in the blood test that we see. The hemoglobin starts rising because what we have heard is if anybody says dengue, they say oh platelets is down. No, it's not that case. It is along with the platelets. You have to look at many things. One of the most important things that has to be looked into is your hemoglobin. The hemoglobin during dengue second phase keeps on rising. This is a phase where you get dehydrated. So your hemoglobin can rise from 14 to 15 to 16 to 17. It is very important for us to identify this phase. And at this point, we need to hydrate the patient. Treatment for dengue is good hydration in terms of giving oral liquids, in terms of giving IV fluids. So during this phase, the hemoglobin rises, the platelet drops. The drop in platelet, which has a normal count around 1.5 to 4.5 lakhs, can go down even up to 10,000. This drop is a sequential drop which occurs over days from day 4 to day 7 or 8. And at one point, when the platelets start dropping, they stabilize, and maybe the next day the rise starts. It is an exponential rise. Means if today the rise is around 10,000 units, next day will be 20 or 30, and then there will be a 50 to 60,000 unit rise. So once this period of 5 to 10 days over, the patient starts settling down. So whenever a patient has been diagnosed with dengue, we as physicians try to explain to them how the course of the disease will be. First 5 days will be fever, a lot of weakness. Second, after the fever subsides, will be the phase of dehydration where they develop loss of appetite, stomach pain, unable to eat, their platelets drop, the hemoglobin rises, and this is a phase when they require intensive monitoring. Well, over the past few years, past few decades, we have seen that dengue has become one of the major illnesses during the monsoon season. And we have a lot of complications also which come out from dengue. A few to be named is this dengue hemorrhagic fever. Fortunately, we don't see much of that. Dengue can involve your lungs, causing stiffness of the lungs, also called as medically ARDS. It can involve your kidney, causing acute kidney injury, where the creatinine will go up. It can involve your liver to cause increase in the blood test for the liver. So, all said and done, when you diagnose dengue early, you will be able to treat the patient well, monitor the patient well. The next disease after malaria and dengue, what I talk about is a mosquito borne illness called as chikungunya. Chikungunya is transmitted by the bite of the Aedes virus, Aedes mosquito, and this has a different kind of presentation in the sense that all infections, all these mosquito borne illness will present with fever. So fever, body ache, and all that. The differentiating point for chikungunya is that after the fever resolves, after the patient becomes better, there is still a residual joint involvement in the sense that the patient will have severe joint pains for months which go on. Very important to diagnose chikungunya and treat it accordingly. So this is one more disease which is quite prevalent during the monsoon time. Few other diseases during monsoon and generally which is mosquito borne is Japanese encephalitis. Japanese encephalitis, the name encephalitis means involvement of the brain and its coverings. So this usually presents like fever, the sensorium is altered, the patient can become drowsy, and Japanese encephalitis is transmitted by the Culex mosquito, and this is quite common in younger children, and it can lead to a lot of residual brain damage. After Japanese encephalitis, we have a term called as filariasis. Well, filariasis also is transmitted by a mosquito bite, and this the organism is Worcheria bancrofti, which is an organism which goes and infects the lymphatic drainage, what we call, and this leads to blockage of the lymph, leading to swelling of the limbs, the leg swelling. Elephantiasis is one terminology. So, this all diseases are caused by the bite of a mosquito only. Also, we talk about Zika virus. Zika virus is also due to bite of a mosquito called as Aedes. This is a unique disease because it has got two modes of transmission. One is by the bite of a mosquito. Also, a pregnant patient can transmit it to the fetus. So the baby can be born with a Zika infection. So, along with fever, body ache, and all that, we can have neurological affection in Zika, which is a stage which is called as GB syndrome, where you have a weakness of all the hands and the legs. There is a power which comes down. So this has to be seen. Also, it can cause brain involvement in newborn babies. So Zika virus is one disease. Fortunately, not very rampant at this point of time in India. We have got spurts of this illness in the past, and it has been well controlled. Now, these are the various diseases that a mosquito can cause. What are the causes? We already spoke saying that during the monsoon season, because of poor sanitation, because of waterlogging, the urbanization which has occurred, there is a lot of construction happening, building constructions with a lot of water stagnation which occurs. All these are breeding ground for mosquitoes. So this can cause mosquito-borne illness. A word about what impact does this mosquito illness have? Well, definitely, if you look at the financial aspect, it is a very big burden on our healthcare system. Imagine that during the monsoon season or during the spurts of these mosquito-borne illnesses, the hospital beds capacity has to be increased by the government or the health authorities. The diagnostic testing has to be increased. We have to be more vigilant about door to door surveillance. We have to, if a patient falls ill, the cost of hospitalization, cost of loss of work, and a relative who accompanies the patient. So the finances that we look at in this burden is quite high on a disease which is a preventable disease. It's a controllable disease. If you control the vector, the mosquito, definitely the incidence of this disease can come down. If you look at for a few years back when we had COVID-19, which was quite the pandemic which happened, what we had noticed during that time was the incidence of dengue and malaria was quite less during that monsoon. So what does it indirectly imply is that sanitation was better, cleanliness was better, everybody was aware about keeping their surroundings clean. So this helped to cut down the vector, the mosquito. Hence, the mosquito-borne illnesses had come down drastically. So, as a physician, the need of the hour, the reason why that we have this topic to be discussed during this season is that we have to be vigilant. Now, suppose let's give you a very simple algorithm for fever. If a patient develops fever, so the symptoms of cough, cold, fever, body pain, shivering, all this can be there. Please take care during the fevers. First thing is that we advise is you need to take a medication which will bring down the fever. The most simple antipyretic, what we say, is paracetamol. Please do not take over the counter painkillers. These painkillers will cut down your fever, but they will give other complications. We usually try to encourage medications at the earliest, treatment to be started at the earliest, and we encourage a blood test. The timing of the blood test is very important. Suppose if I do the blood test on the first day, what can I pick up? Well, I will be able to pick up, I will be able to see the hemoglobin, the WBC count, the platelets, and when I examine the smear, I will be able to see if there are any parasites, that is the malarial parasite. On the second day of the fever, if I do a blood test, I will also be able to identify that along with the hemoglobin, the platelets, and the parasites which are seen, if the dengue antigen is positive, well, for diagnosis of dengue, we have two or three tests. The first one is dengue NS1, which is called as a rapid test. It becomes positive on the first or the second day of the fever. It can be positive up to the seventh day. After the seventh day, there is a dengue IgM which comes into the picture and then it becomes positive. And long term dengue infection can be the IgG which becomes positive after 3 to 4 weeks. So, the timing of the test and what test you're going to ask is very imperative. Then we also look at check the urine for any infections in the urine. We check the other parameters like the liver functions and the kidney functions to see if there is any impairment in that. The government, the health authorities are very aggressive during this monsoon period in terms of setting up fever clinics, encouraging immediate blood tests for the patients, and diagnosing and treating the diseases early. Since all these diseases are diagnosed early, it can be treated and we can prevent a lot of complications. Well, an untreated fever can have complications in terms of involvement of the lung, the liver, the kidney. We have young patients who develop complications. So, no age is barred from a complication if it is not treated on time. So, the take home message would be that we need to understand that monsoon, along with the joy, also brings a lot of monsoon related illnesses, whether it is waterborne, foodborne, or mosquito borne. We have touched upon the major mosquito borne illnesses like malaria, dengue, chikungunya, Japanese encephalitis, filariasis, and Zika. A timely diagnosis, a timely visit to your doctor. Please avoid prolonged self medication. If indicated, please do a blood test on time and treat yourself. Lastly, I would say that the weather has been fantastic. In Bombay, we have had a wonderful time with the weather. I wish you all a good health, enjoy the weather, stay safe, and be healthy. Thank you for your patient hearing.